Hi there, my name is Melissa and I am a patient advocate. I have had chronic symptoms for more than 20 years, most of my life, and I have had more negative experiences than positive experiences with medical professionals and trying to get help. I was moderate fibromyalgia and mild ME/CFS when I started my health journey 12 years ago. That's when I recognized that something was really wrong and the doctor was not doing enough to help me, and I needed to take the reins. And so in the last 12 years, I have managed to first, I've accumulated several more diagnoses that were not recognized and should have been. But as I have worked through them with some great medical professionals, I have managed to reduce the symptoms. So I am now considered mild fibromyalgia. And I live in pain levels of around 3 or 4 out of 10 on average, which is incredible because 12 years ago it was about 6, 7 out of 10. I slept terribly. I was miserable. I was in pain the whole day, the whole night. I never slept. I woke up feeling worse than when I tried to go to bed. There was nothing that helped, and I barely made it through the day. And I had a lot of cognitive impairments. I had a lot of trouble with things like spatial awareness. Like, it was pretty bad, and I actually don't know how I kept going. But now I am just far away from that person. There are so many things that even now, new things that I'm like, oh, this is easier, or oh, that thing has gone away. And I will never stop being grateful for the fact that I can actually get appropriate sleep now. I do have to still be mindful and continue with my practices, but I've come a long way. And I have been sharing my journey for the last 10 years on my blog and my YouTube channel. And I have amassed a little bit of a following, people who, like me, are curious and want to work on our well-being and know that we don't deserve to live in very high levels of pain and fatigue with no one helping us. And so today I would love to be able to share what I have learned with medical professionals. I would love to be able to tell you what I would love you to know, what every fibromyalgia patient, I imagine, would like you to know. So that's the spirit of this video today. It starts with thank you. Thank you for being curious. Thank you for listening. I know that, as you know, if you're a GP, like a general doctor in a practice, you've got so many things coming to you and things are changing all the time. I know that it's hard to research up on every condition that's going to come your way. And I know that you probably want the best for your patients, and you probably see the best and the worst. And so when you're seeing the best, you're just like, yay, that's so exciting. But I want to show you that there is better than what might be current best. So I'm going to share first a bit of a breakdown and then a bit of an extension on the key things, the things that I would love for you to know, and I think a lot of other patients would love for you to know. So one important thing that I would love you to know is that your attitude makes a really big difference. So one thing that I missed for a very long time was any doctor validating my experience. It took a very long time to understand, and as a result, my quality of life suffered because I didn't take it seriously enough. And that's probably the result of the fact that there just wasn't as much information around. But even so, it has been really difficult to get that validation and that understanding and that compassion. I have many experiences in my mind of just not being validated, not taking that moment to be taken seriously. And I think if you put the responsibility in the patient's hand, if you can show them, hey, decisions you make can impact your quality of life, we can improve this, then that would really make a difference. And I think if you show them that there are treatment options and there are many things we can do, that would really help the mindset from the beginning. But the other thing is that if they're bringing a family member to the appointment, it would be really amazing if you could remember that this could be make or break. I took my husband to see a pain specialist, hoping that he would get some understanding, and she was so dismissive. I was broken at the end of that appointment, and that really was a make or break appointment in getting my husband to understand. Where having a medical professional, called a pain specialist, be so dismissive really didn't help his understanding of the condition. So I just really hope that you can remember that your attitude really does help. And the other thing I want to encourage you to think about is it really fibromyalgia, and is it only fibromyalgia? So are all of the symptoms attributable to fibromyalgia, or are there other conditions that need treatment too? On the one hand, there are other situations going on. For example, I had endometriosis for a very long time, and that was not dealt with until a couple of years ago. And of course, that was impacting the fibromyalgia. So at its heart, fibromyalgia includes the nervous system. And so other conditions are going to impact the nervous system, and that makes it all harder to treat. I mean, we all know this, right? You're not going to sleep well, you're not going to manage pain well, any of that, if you've got undertreated or untreated conditions. If there's hypermobility, if there is other conditions like IBS, it all needs a treatment plan. And that putting everything into the fibromyalgia category needs to stop. That happened to me for so many years. For so long, it was just fibromyalgia, and it just wasn't. And a thing that I think would be super helpful, and you could probably turn this video off and walk away if you didn't want to keep having a patient advocate experience, is to read Dr. Ginevra Lipton's book, The FibroManual, and I'll put a link below. This book was written by a doctor who has fibromyalgia herself, and she has done a lot of research. She's got some training on YouTube, some videos, and she has a very great insight, being both a physician and a person with fibromyalgia, and I think that book would be very helpful to read. I think everybody with any interest in fibromyalgia should read that book, but she also has a section for doctors, and she goes through everything just so wonderfully. So that would be a big help. Now, in terms of trying to treat your patient, say you've got a patient and you suspect or know that they have fibromyalgia, the first thing I would beg of you is to consider sleep. Sleep is so important. We are not improving metabolic health, brain health, we're not improving pain or anything like that without sleep. And at its heart, fibromyalgia is a deep sleep disorder. For many, many years, literally until I was like 36 years old, I didn't get enough deep or REM sleep every single night. And I can tell you that makes a big difference. So it is important. So listen to your patient when they're telling you, and maybe think of asking them questions instead of assuming, you know, you want to be quick, and so you want to be able to be like, look, we've got to deal with sleep hygiene. But just ask. I once saw a pain specialist, the same one who was extremely dismissive, who said, give her some sleep hygiene training, and then that was it. And if she'd bothered to ask, she would have known that not only do I have impeccable sleep hygiene, but I train other people about it. I teach people about good sleep hygiene, because the aim is to get to the doctor and say, look, I have tried all of these things that you would want me to try. Let's talk about the next steps to be efficient about it. But it is useful to have maybe a handout about sleep hygiene of those key things that help. And I would probably add that learning to pace, managing pain, and relaxation training are all part of that conversation. So it is a little bit more than just those regular go to bed at the same time, keep your room dark and cool and that kind of thing. You are probably going to need medication, and it might not be the medication in your little module. So I actually took the module that they give to clinicians here in New Zealand about insomnia, and I was a bit disappointed to see that only amitriptyline was on the list. You can try it, but it did not help me at all. Like, after all those years on it, and everyone, the only suggestion ever was increase the dose or try it again when I had gone off it. At the moment, for the last actually 3 years, quetiapine at a low dose, 25 milligrams, has made a massive difference for me. It does not take away from my sleep hygiene and all of the other things I do to be well, but it has made a very big difference. The nervous system is just absolutely involved, and it's not as simple as do a relaxation technique. You can tell there has been research that shows when your heart rate is above resting for more of the night, then that's indicative of what symptom levels will be doing the next day. So for fibromyalgia, if their heart rate has been high overnight, then the next day their symptoms will be higher. And that just shows that the nervous system is so involved there. So it is going to take, I think, sleep medication. Dr. Lipton's book, The FibroManual, has a really excellent chapter on sleep. But I just really implore you, sleep is just the key. You can't improve without sleeping. The second thing is then to consider pain. I like the research. I've been following the research of a practicing rheumatologist called Dr. Katz, and he found that the intramuscular pressure in fibromyalgia patients is 3 times higher than regular patients or regular people. That means the muscles are just sitting there tight and they don't know how to relax, and they are exhausted and they are prone to injury. There's also research coming out that shows that there's not enough energy getting into the muscles. So whatever your belief of the pain associated with fibromyalgia, it's worth treating. And Dr. Katz recommends muscle relaxants for releasing that muscular tension. Of course, you want to consider relaxation techniques and that kind of thing, but that's highly unlikely to be the whole answer here. You want to also consider other causes of the pain. Is it structural? Is there hypermobility? Are there other conditions that need to be treated? Because it's not all fibromyalgia. And again, you've got to treat pain to support the nervous system. So while the nervous system can be contributing to pain, your pain contributes to the nervous system. Until I had the operation to remove the endometriosis and the heavy, painful periods and that smash on my nervous system all the time, my nervous system was never going to be able to down-regulate, right? It was always getting attacked. And until I started being able to manage my neck and back pain appropriately, which has been a problem for a long time, again, it's just always smashing the nervous system. So thinking of treating pain as supporting the nervous system, I think, is a really important way to orient in this treatment. Other things to consider, I think low-dose naltrexone is something that's really worth considering. The research is spotty. I'm a bit disappointed with some of the research that has come out. However, it helps so many patients so much, including myself. Like, LDN changed my life. It is worth a try, especially considering the side effects are so benign. The side effects that usually happen are transient, but so benign compared to any other treatment that they are currently recommending for fibromyalgia. So LDN is one to definitely consider. Physical therapies, such as chiropractic. So I saw a physiotherapist for a long time, and that helped keep me going. So it kept the neck pain down enough so that it wasn't causing severe headaches and severe pain. But chiropractic has actually made a difference, and I believe that's the impact on the nervous system. Nutrient deficiencies. It is highly likely patients are going to have nutrient deficiencies and they need to be corrected. And I think we need to look at whether or not those results that come back, is the bottom actually optimal? For a long time we called my iron levels normal because they're at the very bottom of a very high range, but actually optimal is much higher. And getting optimal made a big difference. There is a big difference in the fatigue and lethargy and other symptoms that come with very low iron and the other types of fatigue that I experience. And the other thing is to consider nutritional intolerances. So I know that there's not a lot of training for medical professionals in the nutritional part of it, but I think this is an emerging field that needs to be watched. I am very curious about the many studies on keto diet for health and neuroinflammation. So I think that's worth considering if it can be done safely and in a supervised manner. I have never felt safe enough to do it because I don't have any medical professionals who understand. So that's not something I've done, but ascertaining nutritional intolerances is very important. For me, dairy and caffeine have made a big difference, and there are a few other things. And again, it's just like, it might look like IBS, but if you take away the intolerance, then it's okay, and then you're not smashing that nervous system. And then, of course, there's things that the patient can look at. I would encourage MBSR, or the Mindfulness-Based Stress Reduction Program, which can be accessed in the book Full Catastrophe Living by Jon Kabat-Zinn, or other relaxation training. I find Yoga Nidra guided meditation to be super helpful. I use it each day as my full stop rest break. And so that's part of my pacing, part of fatigue management, but it is part of my pain management, but it is also part of helping support my nervous system. Things like natural sunlight. People have started talking about red light devices, and we've got one out the door. Getting natural sunlight is just important. That's how humans have evolved. We have always been outside. Gentle movement. And this is a problem because often medical professionals throw it out at us. Go exercise. Start low and slow and work around problem areas. And also look at the evidence. The evidence from what I've seen is be very mindful of aerobic exercise. Don't just go out and start trying to do a long 30-minute walk. But actually, how about consider resistance training, strength-based training? And it can be started low. I started with 5 micro squats and 5 leg lifts, and then cat and cow pose and Superman. So it was very, very small movements, very gentle movements. And over a period of a long time, like 9 months, I moved up until I was able to do several bodyweight exercises and do 3 sets of 10. But it's actually really valuable, and there's a lot of good research talking about the value of supporting our muscles. So that is a really important area to encourage them to look at, but unfortunately it's going to be quite difficult to get good advice about it. Reduce processed food. It just has to be done. Of course, people are exhausted and in a lot of pain, and so they want to turn to easy food, but if we can reduce the processed food, obviously it's going to make a difference. Increasing hydration. Making sure that we have enough water and we're not drinking too much of the nonsense stuff. All of these things are things that the patient can look into themselves, but I know that was a lot, but it obviously doesn't need to be all at once. But these are things that I just wish someone else had been able to tell me, because I had to learn it all myself through trial and error, through reading a whole heap of research papers. And until the last couple of years when I started sleeping properly, it was very difficult for me cognitively to understand and kind of translate the research papers. So it's quite a lot, but I mean, if you can help your patient with understanding, with making sure it's the right diagnoses, with getting that sleep and working on that pain, you can make an unbelievable difference. So I really hope that this has helped. I hope you'll consider reading Dr. Ginevra's book. And I just thank you again for being here and watching this. And if you are a patient or a family member or a friend, I encourage you to show this to your medical professional, or just let them know about the book. I really believe that with the right treatment and getting started earlier can make a massive difference. I have made a massive difference in the quality of my life, and it took me a long time to get any help. By the time I started my healing journey, I was burnt out. Most of my systems in my body were impacted, and I had a lot of work to do. But our body wants to be well. It wants to work efficiently and effectively. And so if we can remove the problems, if we can fix our nutrient deficiencies, if we can sleep, oh my gosh, if we could just sleep, and if we can treat pain, then the other stuff comes much more easily. I wish you luck, and I'm so glad that we can do this journey together.